Actually, in the hospitals, we don't sell blood. It's prohibited to sell any part of your body, including blood. Blood is such a commodity that cannot be manufactured outside the human body. And the only way we can get blood is through donation. And we also know that there are so many conditions that blood transfusion is needed for the care of that patient. For example, you have road traffic accident, you have a pregnant woman bleeding during pregnancy or during childbirth. You have even cancer, you can't treat it sometimes without blood and blood products. And therefore, you will agree with me that blood is very critical for human being. And being such a very expensive and rare commodity, the only way we can get it is through donation. So the day is just set aside to not to attract large number of people to come and donate, and then they will go, they will not come back until next year. No, the day is set aside to celebrate all those that have been donated regularly. What I mean by regular blood donation is those that have been donated every 3 to 4 months in their lives. So health-wise, it's okay. You can donate blood up to 3 times in a year, and at the interval should be between 3 to 4 months apart from last donation. So this is very important. And also the day is set aside to encourage policymakers to make deliberate efforts to address the challenges that we face in hospitals towards blood transfusion services. So it's also set aside for not only for the policymakers, for also for our business community to come and assist the government in achieving the availability of safe blood. Because not only the availability that is very important, also safety is also very important. So when we collect the blood, we do screen it to make sure that both the donor and the recipient are safe. So that's why this day is very important for all of us. The private sector and business community can help government to achieve the mandate for availability and safety of blood. They can assist us in various ways. It can be through supporting the agency toward achieving its mandate for the provision of safe blood in the country. We have a lot of gaps that the government cannot do it alone. So be it organizing world blood donor drives in the community, because we do go to the community and encourage them to come out and support us. So the private organization and business community can come in to help us. Some can do the talking to the community, more especially like the corporate social responsibility program, so that they can talk to the community, can sponsor the blood donor drive into the community, and they can also support the agency in establishing blood banks across into the community. So there are a lot of ways that they can assist us in achieving our mandate. The government through the agency has done a lot in order to toward achieving the regular supply of blood donation in the country. For example, when we came on board last year, there are a lot of infrastructural gaps, and even the services were very down. So through the Mr. President's initiatives on renewed hope initiatives, so through the Federal Ministry of Health and Social Welfare, we came up with a renewed hope national blood program, where we intend to revamp and rehabilitate all our zonal offices in the country in order to make them not just blood banks, but centers of excellence in blood transfusion in the country. We are working toward that, and we're also working toward establishing more centers across the country in each of the states of the Federation. And we also have regular programs now where we go to the community in order to talk to them to see the needs for blood donation. So through the National Blood Management System, we plan to make all the hospitals and other blood establishments, be it public or private, to come together and work together So we have a software now that we are already finalizing on it, whereby all the requests will be online. So and we'll also be able to track blood from donation down to the recipient. That's the patient that will use the blood, and in such a way that we'll also be able to track the availability of blood itself, so that when I'm still in Abuja, the Abuja office is looking for blood that is not available here. So we can easily see it on the screen that, okay, this part of this type of blood is available in Lokoja, so that we can now easily transport it to the Abuja office. And we are also working, we have already signed an MOU with a drone services zipline, where we will now employ drone services to deliver blood to hard to reach areas. So currently we are finalizing on piloting the system in Bayelsa. You know, in Bayelsa State, we have a lot of riverine communities where you can hardly reach them on time. So we are tapping into that technology to see that blood is available everywhere. So we are currently piloting it in Bayelsa. So once it's okay, we can now go ahead and deploy it to other states, more especially those areas that we have insecurity issues, whereby the roads are not very safe. So we are trying to see that we use the drone to supply such hospitals and the communities blood on time. I remember when I first donated blood, I was scared. Some people have fears, maybe because of the pains they're thinking that they can pass through, or some religious beliefs or cultural beliefs, whatever. So there are a lot of things that are happening in the community. But the only thing that I used to usually tell first-time donors is donating blood is safe. Donating blood is also good for your health. Donating blood is good for the community. You are doing a service to your community. So first, when you look at the fears, I can say it's not painless, but the only pain you feel is that of inserting the needle into your body. So it's just like a pain that you feel when you are being given injection. That's the only pain. And it's also safe because we that are taking the blood from you will make sure that you are fit to donate before we collect your blood. So what I mean by that is we can't just grab somebody on the streets and take him to the couch and then start collecting his blood just like that. No. Our duty is to ensure that both the blood donor and the recipient are safe. We have red blood cells, which are the ones that we needed mostly for blood transfusion. And then we have the platelets. If you look at the platelets, they die after every 7 to 10 days. So individual cells. The same thing with red blood cells. Maximum is 120 days. So they will die. So in essence, even if you didn't give it out, you will still be replacing them as time goes on. So that's why I always say it's better to give the blood to help somebody than just to allow it to die naturally and being replaced, and it's not helping anybody. There is no joy more than helping somebody that you don't even know. And once you donate the blood, 1 pint, that 1 pint of blood that you are donating stands the chance of saving sometimes up to 3 lives, because there are what we call blood components. Blood is not just the red parts. There is plasma, just like water, that is in the blood. And we have also platelets, they are there. So we usually separate the blood into what we call components. So we can produce up to 3 components from 1 unit of blood. So some patients, their need is just the red blood cells. Some their need is just that plasma, that watery aspects, that yellowish water that you see after blood transfusion. That's the only thing they need. So we can take it and give them to save their lives. Some they need only platelet, more especially those patients with cancer and they are on treatment, so they run short of those platelets. So we give them the platelet. So you see, in essence, by donating blood, you stand the chance of saving up to 3 lives. So there is no joy in this world than to save life and serve humanity. Yeah, the only way I can address that is when you and I agree to donate blood. Because this racketeering that you are talking about, selling blood, actually in the hospitals, we don't sell blood. The blood you give us, of course, we charge some, the hospital do charge, are allowed to charge some money. The money they are charging is not for the blood itself, because by the National Health Act, it's prohibited to sell any part of your body, including blood. So it's illegal as far as Nigerian constitution is concerned. So what they are allowed to charge is for the services that are associated with the blood transfusion. For example, like I said earlier, when we collect the blood, we make sure that it's safe. How do we make sure that it's safe? There are 4 major infections that each and every blood must be screened for. And these are HIV, hepatitis B, hepatitis C, and syphilis. These 4 are blood-borne diseases, and there is chance of blood, if not properly screened, for it to transmit these 4 viruses into somebody. So, and apart from doing the screening, they use money to do the screening. Apart from the screening, they also do what we call cross-matching or compatibility tests to make sure that the blood they are collecting from Mr. A is compatible with the system of patient A. So in essence, in the lab, they take the blood, part of the blood that is donated, and then take the patient's blood, and then mix them and do some testing in the lab. So once the reason for doing this test is to make sure that the blood is compatible for the individual, not just the A, B, O blood groups that I'm talking about. You know, initially I told you that we have blood groups A, B, and O, and AB. There are 4 major blood groups. So we don't give blood to anybody. So we make sure that they are first and foremost blood group compatible. After ensuring that they are blood group compatible, we have to also make sure that they are compatible in the body of that patient. So they mix them, they do. So it's also money that does that. And then the other services that they render, maybe put you in beds, accommodation, and all these small services that are linked to the blood transfusion. And that's why they charge money for the services. I know there are so many people that are involved in selling blood, which is illegal. And very soon we are going after them. We have a lot of challenges. Like I said earlier, I just said a bit of it earlier on. The challenges are many. One, we have already addressed it, the issue of misconception in the community about blood donation and blood transfusion and all these things. So the public awareness is very important. And that's why we are partnering with the media organizations and in order to help us propagate the message. We are also working with the religious bodies. We have been to churches, to mosques and talk to them about the importance of the blood donation to the community. So that's what we are doing to address that. And also, like I said earlier, we have a lot of, within the agency, we have a lot of infrastructural gaps, which the government is now approved for us to revamp all our centers, more especially the zonal offices, like I said earlier, to make them not just blood banks, but centers of excellence in blood transfusion, whereby all the nearby hospitals, teaching hospitals, will come to them for solutions to their blood transfusion problem. Electricity is one of our major challenges because blood must be stored in a regulated temperature. The temperature is between 2 and 8 degrees. So you can see it must be maintained. So what we are doing now as an agency is to make sure that all our blood bank refrigerators are solar drives in order to address the gap, because some of our centers have electricity issues. So far in the Renewed Hope National Blood Program, we have already installed solar power in Ibadan office, that's the Southwest office, and also our North Central office in Jos and our Abuja office. So we are rolling it up to all our centers, and before the end of the year, we will make sure that all our centers are solar power backed, so that at least we address the gaps in those areas. There is big shortage of blood in the country. By standards, we are supposed to have not less than 2 million units of blood. That's in essence, at least 1% of our population should be donating blood regularly. When I mean regularly, like I said earlier, is at least three times in a year. So, but so far, based on our records, we are only able to meet up to not more than 30% of our needs. So you can see we still have about 70% gap that we need to fill up. So this is why we are calling on all individuals and corporate bodies to come and assist us to propagate this message of blood donation into the community. And we're also encouraging people to come out and be donating blood regularly. Blood donation is safe, and we will make sure that you as the donor is protected and you are not harmed by what you are doing. Our priorities are just very simple: to make sure that the blood is safe for everybody, and to make sure that blood is available for everybody that is in need of blood. These two are our major priority. We are working hard to achieve them, as I enumerated before, so that we make sure that the blood is available for everybody and when they are in need. But like I said earlier, we cannot do it alone. We need the cooperation and commitment from everybody, every Nigerian, to come and assist us in a way that he can, be it blood donation, talking to the community, preaching the importance of blood donation, and also talking to even sponsoring some of these programs that we are doing. So that's our major priority for